We all know, or at least we should know, we should be assessing our work environments for hazards all the time. Continuing care healthcare workers are susceptible to hazards in what is often looked at as a benign environment. After all, who could get hurt in an old folks' home? However, the answer to that and the additional facts might surprise some of you. In fact, while only comprising a little over 6% of the full-time equivalent employees in the workplace, Alberta healthcare employees, which includes healthcare aides and nurses, are collectively responsible for almost 20% of the overexertion injury claims in Alberta and responsible for 13% of the fall injuries. And 83% of all workplace violence injuries involves a healthcare worker and a resident or patient. So for us, the risk of injury is really high and even higher for pretty inattentive. But we can reduce that risk. When a healthcare worker practices a point of care risk assessment, it promotes a safer work environment so the worker can perform their tasks like caring for residents. I suppose the next question is, what is the point of care risk assessment? The point of care risk assessment is very similar to an informal hazard assessment used in many other industry sectors, except it centers around the care of the resident or the patient. In other words, it's modified just a bit for the healthcare setting. Healthcare workers are, or they should be, performing a point of care risk assessment prior to providing care for residents or patients. A point of care risk assessment will take into consideration the resident's previous history right up to the entry into the room for that point of care. Caregivers are susceptible, both violence as well as soft tissue injuries, and most care provided for these residents will involve some sort of physical contact. If the resident care plan states they can be assisted by a single caregiver to stand or transfer to a chair, but they're not lucid or they're behaving abnormally, then a single person transfer shouldn't be attempted. On a similar note, if a resident care plan is stated that the resident tends to lash out if they're not fully awake and prepared to be approached, this also poses a risk for harm to the caregiver. Other points to consider should include the working environment. In other words, what is seen on the entry into the room, the state of the room, or the surrounding area. Once a healthcare worker surveys their scene and completes a point of care risk assessment, they can do what they do best and care for that resident or patient. If you want to know more about the point of care risk assessment and how to conduct it, you're going to have to watch this video here. Remember, you have to take care to give care, so let's stay safe.